We told you earlier this week, Ohio does not have complete data on the race or ethnicity of people who are hospitalized with or die from coronavirus, but numbers from other parts of the country show African Americans are dying at disproportionate rates. News 5's Olivia Fecto spoke with medical professionals who explain what might be behind it all.
Even without complete race and ethnicity data available, the Northeast Ohio Black Health Coalition says it's clear there's a divide in who's dying from COVID-19. Ivanka Hall with the Northeast Ohio Black Health Coalition says that's in part due to underlying conditions in the African American community.
Hypertension rates, we have diabetes, we have different cancers, we have kidney disease.
She says this isn't just a racial disparity in healthcare. Income disparity and other inequities play in too.
What happens to the least of us? What happens to our children? What happens to our most vulnerable populations?
We've just been trying to take care of patients and keeping people alive, whether they're men or women or African American or whatever.
Dr. Dee Banks is an infectious disease doctor based in Youngstown. She started wondering why Ohio didn't have complete data on race or ethnicity of COVID-19 patients after finding out Milwaukee County had data that showed nearly 3/4 of COVID-19 deaths were African American patients in a county where just 27% are Black.
As Dr. Fauci said yesterday, this is shining a bright light on an unacceptable situation.
Dr. Banks says these disparities in the African American and Latino communities are nothing new, but she hopes this will spur a focus on improving health and outcomes. As for the Northeast Ohio Black Health Coalition, they're already on the ground, delivering food and medicine to neighborhoods where people might put their health at risk just to go out and get those things. Hall says more complete race and ethnicity data could be used for good.
We can look at data and crunch numbers all day and say, Black people are dying. We know that's happening. And we know that we have these disparities. But it's what do we do to make sure that the hardest hit populations aren't punched continually?
Dr. Banks says she hopes when it's time for drug trials and vaccine trials, African Americans and Latinos will be included, making sure there's more diversity to find out how everyone is affected. Reporting in Cleveland, Olivia Fecto, News 5.